What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering how to stay calm during true trauma imaging. So to give you context, I am a night shift Xray tech. Been doing it for over 4 years. Trauma 3ER in the great state of Texas. So in my beloved hospital throughout the years, I've seen a range of many traumas, both the daytime and nighttime. I work ungodly amount of overtime by choice. So I've seen a pretty good amount. At this point in my career, and I can't really think of many things that could come into my hospital that would put me in a state of like shock, or like I wouldn't be able to perform my images properly. Even if I think it's like the worst thing that could happen is like maybe your own family member, then you'd kind of feel the way. But then if it's your own family member, you would let someone else do it, both for legal purposes and so your own emotions don't get in the way. But like I've seen some pretty intense stuff. Like there was a dude whose leg broke because he crashed into a tree and his whole leg was decapitated, and like his leg was intact, but like the bottom, I would think it was like the tip fib, and the tip fib was like extracted out. It's like almost like they pulled out just the bone, and it was hollow inside. It was just pretty cool, but like you felt bad for the person, but like the foot was just standing there with the tip fib, and then it was a very surreal experience. It almost looked like a Halloween prop. It was weird, but anyways, I would say that majority of the times in a true trauma situation, depending on what's going on with the patient, there's going to be a lot of people in the trauma room, both nurses, maybe police officers, doctors, you got surgeons, you got ortho people, you got a bunch of stuff going on. It looks like a little village of ants running around yelling and doing all stuff. Now, if you're brand new to the field, or sometimes we go to the trauma room with students and you quickly get to see, the younger version of yourself. Because when that tip fib came in, the student looked at me and she wanted to comp on it to get a little check off of tip fib. And I was like, okay, we'll see how the patient is. As soon as we got in there and like the students started to see everything, they looked at me and they kind of froze. And the doctor was like, we're gonna need this, this, and that. And then I looked at the student and I looked at the doctor and I was like, I got it. And then I looked at the student, I'm like, do you got it? And then they're like, I need a moment. And I was like, well, we need to get these pictures done. If you need a moment, just stand by the door, I'll take care of it. But like, I could see how in a true intense trauma, you can get into a state of like it becomes overwhelming, especially if you're new to the field, or like trying to adjust the angles, people yelling, even the patient trying to, move, and then they're talking to you, and like there's a lot of distractions. Like I think sometimes it'll be the most normal patients, not true life or death, will just be talking to you and asking you questions and all that. And meanwhile, they have like 10 x-rays ordered and you're trying to concentrate and not mess up. Sometimes that throws me off a little bit. Or when I'm a student and I'm trying to do something and they'll ask me a lot of questions, and then I'll switch from the student to the patient talking, and I'm like going back and forth. And then maybe like I get a call from like the floor, and I'm like, sometimes it can be a little bit overwhelming, but at the end of the day, you just got to kind of lock in and kind of focus. Me personally, anytime it's like a super intense trauma coming in and you don't have that many times to shoot the picture, majority of the time, it's almost like, I've caught myself where I'm just kind of focused on, like, it's almost like my body kind of blocks out all the noise and everything's going on, and I'm just there looking at the patient, looking at like how I'm gonna get this tip fib, the ways I have to angle the tube to compensate to get the most optimal images. And like, it's almost like, regardless of what's going on with the patient, the yelling, the screaming, I'm just locked into his leg or whatever is need to be x-rays just to get the most optimal images. There's been times where I'm just so locked in that the patient will be there like feeling like I'm not paying attention to him when I'm paying the most attention to him, and he thinks I'm being rude. And then later on, when they give him drugs, they give him, the pain medicines, or they actually fix his leg or fix whatever's going on with him, they'll start apologizing because they're being mean or they were cussing and yelling. And the whole time I was like, yo, bro, you're not gonna hurt my feelings. I saw what was going on, and I would be, in pain too. It's cool. And so like, I would say some of the stuff, it just comes with time. There's people who have more of a soft heart, or like they're more like they'll feel bad. They'll be more like, it'll be harder to get stuff done when it'll be some intense situations. Empathy, or how do I'm trying to find the correct word, but like, it's more difficult for people to, me personally, if the doctor's like, yo, we need this, this, and that, I look at the patient, assess the situation real quick, and I'm like, guys, so you're gonna be cussing and yelling, but I'm gonna need to get these pictures so we can get you some help. And sometimes the patient will be like, I bet. I'll work with the other times. They'll be cussing and yelling, and I'm over here like, just shoot it, come on. The doctor needs this. He didn't say the magic word no. So, come on. And then you just kind of push through it, and you just, There has been, I think, only like one trauma situation, and it wasn't even like the patient his shit was like broken or destroyed. I think he was in a motorcycle wreck, and he had a little skin burn on his butt, and we had to do a pelvis, and he wouldn't lay down all the way on his back, and he kept on lifting up and moving, and he was causing a scene. Even the nurses and the doctors were like, at first they were thinking something major was broken, and then I got like a scout picture before I could continue, and then after that they're like, sir, you need to calm down. Like, nothing is majorly wrong. Like, the pain level of tolerance of people that you'll see is on a spectrum. Like, you'll see people where their stuff is destroyed, and then you look at them, and they're like, are you good, bro? Like, did they give you medicine? And they're like, no. Do you want me to position to this? How you want my leg? And they'll just be like moving their stuff, and that shit destroyed. And you're like, sir, don't do that. You just hold still. We'll cross table. You shouldn't be moving. Like. And then there's people on the other side of the pain level of nothing. Like, you'll shoot it perfectly fine. Like, for a fact that's on the report's gonna say remarkable or whatever. And it might as well be like their femur was shattered. And sometimes they get pain meds, sometimes they don't, depending on when we meet them. And that will also throw you for a loop, because like, sometimes you'll go into the room, you'll see the patient, and then depending on how they are, you can kind of gauge that, okay, let's not move anything, we'll just shoot it the way it is, because most likely it's dislocated, broken, or whatever, right? Sometimes we shoot it, and then as soon as we shoot it, we look at it, and do a little up and down assessment, and then we can be like, we're gonna have to do some little extra different maneuvers, extra views to work around it, because it's broken. Like, in your head, you're like, okay. However the patient's reacting, it's understandable. Other times you look at it and you're like, sir, nah, you come on. There's like a certain level, which I know for nurses, it's a little bit different, because my lady's a nurse, and anytime they see us positioning and we're like causing any pain to these poor patients, they'll come in as advocates, and I'm like, ma'am, I'm just trying to do my job. And as you want to look at the X-ray, you can see it's not that bad for the patient to be reacting like this. Because sometimes it'll be the nurses that will cause us from not being able to get the most optimal images, because they'll see us how we're like have to like maybe adjust the patient or move them, and they think we're causing more harm or more pain and more. Then they'll step in, and sometimes I'm like, sometimes I'd rather it just be me and the patient and no one else, because like or sometimes it'll be the family members. Like sometimes it'll be the family member and they'll see their family in pain, or sometimes the family member will be saying more stuff than the actual patient. That patient will be fine, and then the family member will be the one who's like overreacting and doing it, causing problems. So you see it all here at the beautiful emergency room. But usually, as long as you stay focused, locked in, don't shoot the wrong patient, get the most optimal images possible, you should be pretty good. Some of this, it just takes time. I mean, the tech I work with, she came from like ortho, non-trauma, non-hospital, and like it was real quick. She looked at me, she's like, Miguel, is this what awaits for me? And I looked at her and I was like, usually it's not that bad, because like the first day she worked at, it might as well look like Grey's Anatomy, the amount of chaos we had. And she was like, Miguel, I hope to God this is not how it is every day. And I looked at her on night shift and I was like, this is probably the most extreme cases we get, but usually it's more chill. She's like, okay, because like I was about to quit, and I was like, just laughing. I was like, so it all really is based on like perspective on like your experiences and like how you view stuff in situations. But now she's doing good. So, but anyways, hope you enjoyed today's video as I educate you in this beautiful world of radiology. I'm about to go push the button. It is the weekend. Today can go either chill, or the local city can start having fun. People like doing fun stuff during the summer, and then they'll end up at work, and it's Miguel's problem. So if you're out there, stay safe, be careful in the, as I call it, the GTA world, out here with the NPCs, so I don't have to see you at work. So, anyways, we'll see you on the next one.